Hello, good morning, good afternoon, good evening, whatever time it is that you're watching this. Started a little early, trying to do a little quick video. We are out of town. Gary head back home. We were out of town for the weekend. It was kind of a late getaway for Sean's birthday. Sean's birthday was end of February, so we ended up getting away this weekend. Headed back to town, and yes, Bentley is right here with me. Say hi, Bentley. So yes, let me see if I can get through this. I was having some internet issues earlier, so let me see if I can get through this without any internet issues. So actually, how was your week? Sean had a little bit of a slow week. I say a slow week. I'm sorry. I know that's a term we try not to use that often in veterinary medicine, because you say that, then shit hits the fan. But yeah, no, he kind of had a break this past weekend. Didn't see that many cases, able to get home in a decent time. So that was nice. So yes, March is Multiple Myeloma Awareness Month, as well as Kidney Awareness Month and Clitoral Cancer Awareness Month and Women's History Awareness Month. So yes, it's a lot. But I know it's a little turn, but I want to, as I always said, knowledge is power. And I want to make you aware of some of the things that can happen by not taking care of yourself. Stress and burnout, burnout obviously is from stress. Stress can cause a lot of things physically as well, and definitely burnout's one of it, which also can lead to these things. So I just want you to be aware of some of these things. All right, so multiple myeloma. Multiple myeloma is a cancer that forms in a type of white blood cell called a plasma cell. Healthy plasma cells help fight infections by making proteins called antibodies. And of course, antibodies find and attack germs. I know a lot of this, that the breakdown of some of this you may already know, you may have already learned, but also a refresher is nice with it. And then sometimes too, you might not realize the full breakdown of it, right? So in multiple myeloma, cancerous plasma cells build up in bone marrow. The bone marrow is the soft matter inside bones where blood cells are made. That's why when you do bone marrow transplants, or even when you're testing to see if you're a match with bone marrow, it hurts because they have to dig into your bone and get to that soft part of your bone, right? And then in the bone marrow, the cancer cells crowd out the healthy blood cells. Rather than make helpful antibodies, the cancer cells make proteins that don't work right. This leads to complications of multiple myeloma symptoms. Bone pain especially is, some of the symptoms are bone pain, especially in the spine, chest, or hips. Nausea, constipation, loss of appetite, mental fogginess or confusion, tiredness, infections, weight loss, weakness, thirst, and needing to urinate often. Okay, this could mean a lot of things, right? So here's the thing. Take care of yourself, but also know your body. Like, recognize when these are just some of the things because you're working too hard and you need to slow down or take a break. Or when I say take a break, like take some time off, rest, relax, do what you need to do for yourself. This is going to help you get back to yourself, if that makes sense, what I'm trying to say. Let's see. So yes, how do they diagnose you? Diagnosis is done through blood test, urine test, bone marrow test. That's where I was talking about it. Yeah. Imaging such as MRI, X-ray, PET scan, CT scan. Some of the treatments are target therapies. We talked about this, what target therapy was in, I think, the kidney cancer video or clitoral cancer, one of the two, if not both. Immunotherapy. There's also one called the CAR T cell therapy. So it's training your immune system to fight multiple myeloma. So how do they do this? They do it by removing white blood cells, including your C cells. They send it to a lab. And then in the lab, the cells are treated so that they make special receptors. So and help the cells recognize a marker on the surface of multiple myeloma cells, and then they are then put back into your body. They can now find and destroy the multiple myeloma cells. And this I think is a fairly new treatment. And when I say fairly new, like it wasn't 10 years ago new. Like I mean within the last 10 years. Chemo. They treat it with chemo, and they also treat it with corticosteroids, so which they help with inflammation, but it also works against the multiple myeloma cells. They do bone marrow transplants, so AKA stem cell transplants, replaces diseased bone marrow with healthy bone marrow. So blood-forming stem cells are collected from your body and are given high dose of chemo to destroy your diseased bone marrow. Then the stem cells are put in your body and travel to the bones and begin rebuilding bone marrow. Of course, it's also treated by radiation therapy too. So, all right, why do I tell you all this? One, take care of yourself, because you not taking care of yourself could lead to this as well. Remember, knowledge is power. All right, so take care of yourself. And then, yes, so with that, if you need someone to talk to, you have Lifeboat with NOMV, not one more vet here. So if you need someone to talk to immediately, you have 988. You can call or text 741-741. You can text as well. All right. And then I'll leave you off with this, but it does. For no one else can smile your smile, say your piece, or shine your light. You are unique, and you alone can fill your place. If you were not here to shine your light, what would happen to the pilgrims passing by your empty place in the darkness? Without your light to help them on their way. You may not know that the world needs you, but it does. Remember, what you do matters, and the world is a better place with you in it. Dear person's company, thank you for watching, and have a wonderful week. Do something for yourself.